when September ends.
Pretty, but this time of year, allergies are driving everybody crazy, and the autumn air can make your eyes dry, which can make your eyes feel even worse. Dr. Jeffrey Whitman of the Key-Whitman Eye Center is here to let us know what you can do about those dry eyes. Morning. Great to see you.
Great to be here this morning.
Thank you.
Coolish.
Yeah, it's very nice outside. So what is dry eye?
Well, first of all, a lot of patients don't realize that dry eye is a real disease that in some patients can require lifelong treatment. And the tear film that protects the surface of our eye is actually made of 3 distinct layers. A mucus layer that smooths out the surface of the front of our eye, the cornea, an inner aqueous layer, and then an outer oil or lipid layer that protects and smooths the other layers. And if one of these layers gets out of whack, you have dry eye symptoms.
Okay, so what are some common symptoms of the actual dry eye?
Well, this can depend on what layer is affected, but typically we'll have patients come in with like allergy symptoms, itchy, burning eyes. They might have redness, stinging. A lot of patients will say, it feels sandy, gritty, like something's in my eye. And some patients will tell us, I blink, my eyes get real blurry, I blink again, and it clears up. And that's because when the tear film gets out of whack, it gets kind of sludgy and floats around on the surface, and it can block your vision.
So who is most often affected?
Well, again, anyone of any age can be affected, but typically we see patients coming in 50 years of age or older, more female than male. There's probably some chemical or hormonal influence over that.
Right.
We can see certain medications like antihistamines and antidepressants can be associated with dry eye, and even certain diseases like rheumatoid arthritis and lupus can have a high degree of dry eye with it. And what a lot of contact lens wearers don't know is that chronic contact lens wear can lead to dry eye as well, and this can make the lenses frankly uncomfortable and difficult to wear. But the good news is at Key-Whitman, with our dry eye centers, we can help.
Okay, so that's the big question is if somebody has this, what do they do? What are the treatments?
Exactly, and typically the treatments are going to be artificial tears, gels, ointments, depending on the severity of the problem. But these aren't the drops that you're going to see going down the aisle at the grocery store.
Okay.
So we actually look at what the problem in the tear film is and recommend a particular supplement. As you can see, we have a number here. And if you have moderate dry eye, we may recommend a nutraceutical vitamin like Hydro Eyes that can help supplement and normalize the tear film, make you feel good again. But for chronic or severe dry eye, we really have some special treatments for those patients.
So that's what I was going to ask you. So these are for if you just have moderate
more
dry
typical,
eye.
Yeah.
But what if you have severe dry eye and it's really a problem? What can you do?
Well, first of all, severe or chronic dry eye is generally caused by a stopping or clogging up of those oil or meibomian glands on the edge of our eyelids. And we direct the treatment with some of our advanced painless new treatments like IPL, intense pulse light therapy, iLux. All of these are directed towards warming the eyelid, warming those glands, and expressing them, getting them to open up again so we can normalize the tear film, get those eyes feeling good, and the effect can be long-lasting, 6 to 12 months.
Is that covered by insurance?
Unfortunately, these treatments aren't covered by insurance, but at Key-Whitman, we've really made them very affordable, and our dry eye patients tell us that the cost is well worth it to get their eyes feeling normal again.
And you also make it super easy because you're all over the area.
We have offices all over the Metroplex. But if you're interested in the dry eye treatments, when you call or get online for an appointment, let us know that you're coming in for a dry eye appointment because we only do those at the Dallas and the Plano office. So make sure you tell us what you're coming in for so we can get you at the right office because at Key-Whitman, we don't want a dry eye in the house.
Okay. Thanks, Dr. Whitman. It's great to see you. So the IPL and LipiFlow are only available in Dallas, the iLux in Plano. Patients need to call 214-220-3937 or visit keywhitman.com.